How many of you know someone who's overweight? Maybe you think of a parent, maybe you think of an aunt or uncle, maybe you think of yourself. But 1 in 3 people in your family are obese or considered obese. Today, I am proposing that the state of Oklahoma should make healthier food more accessible and budget friendly to lower the obesity rates. Today, I'm going to discuss what the problem is, how it's caused, and a solution for it. Oklahoma is ranked 3rd in obesity rates in the United States. Oklahoma is trailing right behind Louisiana and West Virginia. Oklahoma has prevalence about 35%, while Louisiana and West Virginia have a respectively 40.1 and 41% prevalence. Now that you know it's a problem, I'm going to explain how it's become a problem. Oklahoma schools have not taught students properly about food choices. Yeah, we get told what foods are good or what foods are bad, but we don't really get told why they're a healthier choice. In 1980, it brought the idea of fast food. Fast food has become a very thing to talk about. Yeah, you can have it for a meal here and there because it's a fun choice and easy. But recently it's become every meal, every day. A pharmacist from Oklahoma, Dr. Kathy M. Campbell, wrote a book titled Obesity, The Modern Famine. In this, she states our fundamental ancestral knowledge of food began to disappear. Children no longer learned about food by working in the garden or on the family farm or watching grandma work her magic in the kitchen or even in a high school economic class. Instead, they learned about food from cereal advertisements during Saturday morning commercials. By not learning about food in daily life, kids have no prior knowledge about what food to eat or what foods not to eat. Without proper knowledge, children in Oklahoma are more likely to go grab a soda more than a vegetable or a fruit. In 2023, Keiko News article titled New Report Shows Oklahoma Children Are More Likely to Grab a Soda Than a Fruit or Vegetable, reported by Colby Terrell, states, the data put by the state help us far below the healthier national averages. According to the report, more than 72% of children in Oklahoma ages 1 to 5 had at least one sugary drink in the past week, which is more than 15% higher than the national average. Oklahoma State Department of Health Wellness Coordinator named Lauren Larson stated, Oklahoma actually ranks 13th in the nation's terms of highest childhood obesity rates, and that means about 1/3 of our children in Oklahoma are considered obese or overweight. In this, she also states, this is largely due to environmental factors, including lack of access to nutritious and affordable foods. About this article, they speak about how children rather go grab a soda than a fruit or vegetable, even if they are educated well. There are many other reasons someone can be obese, but even when students are properly taught about food choices, how can they choose the right food choice when it's not budget friendly or accessible? Price can have an effect of what they buy. In a Hawthorne University presentation titled Diabetes, Obesity, Metabolic Syndrome, and Microbiome with Dr. Liz Lishinsky. She is a licensed nutritionist, and in this, she talks about how a diet is an option, but what happens if the diet's hard on a budget? In this, she states that high probiotic foods are a great choice, but a high probiotic food choice is yogurt. A 4-count of 5.3 ounces of Oakey's Triple Zero 15-gram protein, sugar-free, fat-free, mixed berry Greek yogurt cups are $4.38 according to Walmart.com. Also according to Walmart.com, 8-ounce bag of plain Lay's potato chips are $3. If you were to go to the store and you were going to pick one of those two things based on nutritionist value, you would choose the yogurt. But if you were going based off price, you would probably pick the Lay's. A lot of things contribute to our food choice. Today, I am proposing that the state of Oklahoma make more food accessible and budget-friendly that are healthy. It may not just help lower the obesity rates, but it also helps us lower the obesity in the world and our lifestyle. It also helps improve our lifestyle. Thank you.